Hi guys, so this is a MEI12 patient monitor. So this patient monitor has some special features that some medical practitioners would not really take note of them. And I will show you guys now some of the special features the device has. One of them is a backup battery. Okay. Now I unplugged the device and it's still on. And then patient monitors, you cannot use the measurement you are using for an adult, for infant, pediatric and neonate. So it is not every patient monitor that can perform adult, pediatric and neonate function. You understand? So, but there are some ways, there are some process you use to confirm if the monitor can actually perform these three functions. A lot of them you not even be given access to check because they don't have the features. But this is just a normal patient monitor. You all know. I have our usual probes, SpO2. Then you have this NIBP, and this is what they call ECG, and temperature, and our cough. So it's just a normal patient monitor that have some unique features. So if you want to check if the patient monitor can actually perform neonate and pediatric function, it's simple. This is it. There's an icon here that indicates like a patient. You understand? So without you clicking there, you don't have access to click there. And mind you, this device is touchscreen. You don't need to be stressing yourself with this knob. By the time you under your patient, you see this patient, there's a question mark here, which indicate that there are more options here. You're asking which patient you want to use it for. That's why you're asking question mark there. Every other feature here don't have question mark, just one. You can see it. By the time you click on patient, you look at the options. You have this PED means pediatric. When you click on this drop down arrow, you see adult, neonates. This is adult, ped and neo. So this patient monitor can perform. You can use it to run tests on both adult, neonates and pediatric. So it has one special feature, and then this is the only way you are going to use to detect or to confirm if it has it or not, because some hospitals that deals with maybe pediatric hospital or pediatric clinic, or maybe hospitals that work just maybe pregnant women or something, or babies. If you ask a patient monitor and then they mistakenly get a monitor that's for adults, don't be able to use it to run tests on infant, because this patient monitor is deliberately made, manufactured for adult alone. And don't forget, these accessories you have here cannot work for neonates or pediatric. These accessories are basically for adults, although the patient monitor can perform adult tests, neonates and pediatric, but the accessories that comes with it belongs to adults. That means you have to source for pediatric accessories and neonate accessories. But the good thing is the machine can be used for both neonate and pediatric. You understand? But if you look at this, you see the root adult here. It simply means that everything we have here belongs to adult. If you see pediatric BP cough is different. It's your right P there, PED, or N like neonates. Yeah. And then their own temperature and the SpO2 is different. Some of them they put it on their feet, the SpO2, not tongue. You can imagine a neonate, a small baby, want to use the tongue to know the confirm the pulse. It won't work. So most of them they put it on their feet to be able to read their pulse. So that is it. So this patient monitor looks small, but has this one special feature that a lot of patient monitors do not have. So that's all. That's basically all about this guy.